Committee of the Board of Directors of NYC Health and Hospital for Tuesday, September 9th, 2025. I now call a motion to adopt the minutes of the June 3rd, 2025 meeting. Dr. Katz?
So moved.
Dr. Hawthorne? Okay. Jackie? Yes. All in favor?
Yes.
Opposed? The minutes have been adopted. Today, scheduled to present annual verbal report this evening are the following cabs. NYC Health and Hospital. Cola, it's Cola in the house. Is Jacoby in the house?
Yes.
Yes.
North Central Bronx.
Yes.
Oh, wow.
Yeah.
Hospital McKinney.
All right.
Okay, y'all in the house. I now turn the meeting over to Dr. Katz for his remarks.
Hello, everyone. It's great to see you. I'm not going to go over everything that's in the written report. That would be boring when you have it. One of the best things that happened just this morning, so it's not in the report. It's that the mayor met us at the site of a Bridge to Home program, which I'm very excited about. To me, it's been a hole in our mental health system that's existed, throughout the time I've been at work, which is that for people who are in the hospital receiving mental health care, if they're homeless at the time that they're ready to be discharged, their future is not bright. How are they going to maintain all of the progress that they made in their hospitalization if they're back out on a street or in a shelter without any mental health services? And that is the current state, not just in New York City, but pretty much everywhere. That if you're lucky enough to have a loving home, your family takes you home and they make sure you take your medicines and they watch you 24 hours a day, 7 days a week until you're better. But what if you don't have that loving family? Instead, then there's just a cycle of you're in the hospital, and you're often briefly in the shelter, then your medicines are lost, then you're on the street, then you're back in the emergency room, and then maybe back in the hospital, and all of the good work of the hospital doctors and nurses and social workers is lost. So this program, which is currently on 10th Avenue and 36th Street, called Bridge to Home, has individual rooms, which we know for some people with suffering from mental illness, being in a congregate setting is impossible for them to stand, and is one of the reasons why people leave. And it will have mental health services 24 hours a day, 7 days a week. It will have group therapy, individual, the ability to give people long-acting medications. And the hope is that then people in this group will eventually go into supportive housing. One of the challenges of supportive housing is how do you take someone who is homeless from an inpatient psychiatric ward stay to a home? And the answer is you can't. There are too many steps. Sometimes the first step is to get them an ID. You have to find the apartment. You have to sign a lease. You have to get move-in furniture. Right? You have to figure out who's paying the first month's rent. There are all of these steps. But what we hope is that then this bridge, and that's why it's called Bridge to Home, will then, during the time that they're there, they're getting better, they're getting solid nutrition, safe environment, doctors and nurses taking care of them. And we do the housing applications, we find them an apartment with sufficient support, so then they can move out and then create a spot open for someone else. And to my knowledge, this is the only one that anyone has ever created across the country to deal with this whole. Another analogy I like, if you think about it, is step-down units. You don't have somebody in the intensive care unit for their heart and then suddenly discharge them. You have a series of less intense experiences. But when it comes to psychiatric hospitalization, that's what we do. You're getting 24 hours, 7-day a week therapy in a locked setting. And then we say, okay, you're better. See you in 3 days at your outpatient appointment. And it's no wonder that that doesn't work for most people. And a more sensible system would ramp down the level of support as the person does better and better. So I'm very hopeful. It's a completely voluntary program. Nobody has to be in it, but part of the premise is, well, if you're starting homeless and we're offering you your own room and a roof over your head and good food and people who are there to support you, why wouldn't you stay? Right? Where are you going to? And so our hope is that while it's not a mandatory program, that most people want to stay there. They want to get good care. So to me, that's the top part of the report. A couple of other things that I wanted to mention. We're very proud. Natalia Sinius, our nursing director, has worked really hard on professional development, with the result that our turnover rate in 2025 was just 7%. And people will remember, and I certainly remember when I came, people talking about, well, 40% of the nurses that we hire are gone in a year. And my first thought is, it's not a very good business model. You spend 6 months training the nurses, and then they leave when they have a year of experience and go work at a private institution. Bad business. Forget why it's bad for your clinical care. Bad business. And now we're doing a variety of initiatives, including more equitable pay. I wanted to mention there are 2 programs for students interested in healthcare listed on the second page, and I particularly like that because we often hear, well, why aren't you recruiting more doctors or nurses or social workers? And of course, if people are not going into those professions, we can't recruit them, right? You can only recruit a doctor who's gone to medical school, a nurse who's gone to nursing school, a social worker who's gone to social work school. So part of this is to get people interested in those careers, so then when it comes time, we can recruit them. Our borough president, Antonio Reynoso, continues his commitment to use all of his capital money for health and hospital services. And he's made a huge contribution to renovating the labor and birthing suite at Woodhall, which is now Dr. Wendy Wilcox, who's a major leader among us, has now become the chief of obstetrics there, and I think will do exceedingly well. We had a great public meeting for our Morrisania River Commons housing project. It was the nicest public hearing anybody's ever been to. Everybody stood up to say, what a great project. This is going to be wonderful housing for people. We completely support it. So with that, Madam Chair, I'll allow people to read more detail if they so wish.
Dr. Katz, that was a wonderful presentation. It really was, and the extra part, it's always wonderful. But today it was extra, and especially when you gave the report for from the mayor, because there's so much going on that we don't know about. And that is so key and needed. It is really needed. So thank you for that wonderful report.
Thank you, Madam Chair.
Do y'all agree?
Yeah.
Yes.
Thank you. So thank you, Dr. Katz. We will now hear from the 4 facilities presenting their verbal annual report. Each presentation is allotted how many minutes?
5 minutes.
5 minutes. That is the fun. This is the, I think y'all come just to show off for 5 minutes. I think y'all come to show off for 5 minutes. But before I go into that, Dr. Katz report. Did you have any questions?
No.
Okay. Anita?
No questions. Thank you.
And Jackie, no questions. So 5 minutes is allotted, and we are grateful for the work that went into preparing them. thank you in advance to all our speakers for their time and commitment to the system. And we really do mean that. Because when you sit around this table every quarterly, it shows. I don't know if you're trying to outdo each other or what you're trying to do or show off, but you're doing a great job. So just keep doing it. And I look forward to it. And I just have to tell this quick story. I was so proud, I was at an event and I was so proud when someone came up to me and said, "Oh, hi, Jackie. How are you?" And I said, "Oh, hi." And I kept changing tables and changing tables. And so finally she looked at me and says, "Oh, you're going to change your table again?" And I'm looking at her. She said, "Well, okay, that's all right. I'll see you on the 9th." And I'm looking at her saying, "On the 9th?" She said, "Jackie, I come to your community relation meeting." I said, "Oh my God!" Jacoby. So I said, then I went and said, "Oh, well, which facility?" She said, "Jacoby." So that really meant a lot. So that shows you that they really enter. Thank you so much. Thank you so much. And so with that, we're going to start with Miss Berna Fitzpatrick, our chair from COLA.
Good afternoon, good evening to
Afternoon.
all. And I know it's 5 minutes, so I have my dear friend here, Weinstein, timing me. It's a pleasure to be here. Good evening, everyone. As the chairperson of the Community Advisory Board at Kohler, I'm going to share our progress and initiatives that highlight our ongoing commitment to enhancing our facility and our Roosevelt Island community. Infrastructure and equipment. We are continuously working to improve our infrastructure and equipment at our site. This year, we successfully replaced our generator at Kohler and the nurse call system. Kohler is now actively seeking funding for full renovation of the laundry room. The project includes replacing all washers and dryers and installing a new HVAC system. Construction is projected to begin in the summer of 2026. Kohler has secured an additional $5.2 million in funding to upgrade its electrical system, with construction scheduled to begin next fall. We also plan to pave two of our parking lots to address safety concerns that family and friends and visitors experience. The facility-wide lighting upgrade are on track to be completed this fall, and it will reduce our energy costs and create a brighter and more secure environment throughout the building. We are grateful for the support of our local elected leaders for the Capital Improvement Awards. Elevators are essential to the movement, the day-to-day movement and operation of residents going in and out and to their different locations and programs. This modernization project requires a large capital investment, and we're grateful to the council member Julie Menon and Borough President Mark Levine for their support, which is a great start to a major project. We're also grateful for the awards of our council member Julie Menon and the New York City Council Speaker Adrian Adams for the upgrade of our HVAC system, which will improve the climate control environment for staff and residents. We'd like to extend our thanks to the New York Senator Liz Krueger for her support of the resident lounge renovation, which will create a space for culinary demonstrations and provide residents the opportunity to learn and develop cooking skills, and her support for the comprehensive renovation of the laundry room at Kohler. Kitchen equipment would also be upgraded, which would include purchasing a commercial baking oven to prepare fresh bread and other baked goods. Kohler residents have requested this upgrade as part of the resident feedback regarding food items. And last, after previous securing $900,000 from City Council, Assemblymember Seawright has also secured $500,000 to close the project's shortfall. The intended use of the resident greenhouse atrium support resident center programming, such as gardening, yoga exercises, crochet, and even an NYU writing group. In regards to patient-centered care, we're proud to share that the Press Ganey survey results indicate a strong upward trend in resident satisfaction in terms of the room quality, meal satisfaction, nursing care, and recreational activities. The integration of Plain Tree model with the Kohler eye care values have emphasized not only clinical excellence, but also emotional support for residents. Kohler has embraced a co-design methodology, which directly involves residents, families, and staff in shaping and improving programs, services, and the environment. The approach not only increases engagement, but also ensures that changes reflect the real experiences and priorities of our residents. The facility's aging infrastructure presents a significant financial and operational challenge and requires ongoing repair and includes diverting resources for long-term care improvements and modernizations. Additionally, our resident population has increased with complex needs, with 70% of new admissions requiring specialized support. This requires a significant reallocation of resources, stretching our clinical team. Issues impacting the community continued. The limited ability transition residents for appropriate level of care setting poses a significant capacity constraints. The difficulty in securing appropriate lower level care placement limits our capacity as residents who no longer need skilled care continue to occupy beds. Or accomplishments. Despite the challenges, we're proud to share that Kohler maintains his first quintile top performance in the New York State Department of Health quality initiatives and continues to be identified as a top 10 nursing home in New York. Kohler is also designated as a leader in long-term care equity for LGBTQ plus elders, and in 2024, Kohler became the first post-acute care facility in the country to receive the Beacon Award for Excellence for Memory Care. Kohler earned a 5-star rating in staffing, quality, and overall, and 4-star in health inspection. We're proud to say that there's only one other post-acute care facility in New York City which has earned a higher rating than Kohler.
And that's
That's Souvenir.
That's it.
Yeah.
That's it.
Kenny, I was looking at you over there. Kenny.
So you have 1 more minute.
Oh my God, I'm trying. We recently celebrated our first year anniversary of the Kohler Cafe and the opening of the Kohler Wellness Room and the Employee Dining Hall. We commemorated the lives lost to COVID-19, placing a plaque at the foot of the Kohler Remembrance Tree. We expanded the behavioral health team and improved transportation accessibility. I have to say, very important, I must mention this, that the Kohler Roosevelt Island free bus service, the red bus, finally has begun to stop in front of Kohler. And this has definitely improved, as enhanced transportation, not only for residents, for visitors and staff coming from the train to the facility. And Kohler has appointed a wellness program director responsible for person-centered care. We want to acknowledge and thank all of those who have supported the facility, especially to Mr. Henry Carter and the Wheelchair Charities, to the Kohler Community Advisory Board, the Kohler Auxiliary, and the Kohler Residents Council leadership.
Thank you so very much. Amen. I don't know what your timekeeper was over there doing. No, you said you had a timekeeper. No, but anyway, thank you. Great presentation.
2 minutes, I thought.
Thank you. Yes. So now we go to Dr. Katz.
I think Kohler is a very special place. Kohler takes care of people that no other long-term care facility is equipped to do. and we're very proud of that. So thank you. And I also wanted to thank David Weinstein, long-term successful CEO for McKinney, who we compelled out of retirement to come help us at Kohler. We appreciate that, David. Thank you.
Yeah, and I can add to that, that Mr. Weinstein, from the time he got there, one of the many things that he had to do, he made sure to meet with the Kohler Cab and the auxiliary and the Residents Council. So I'm very thankful for that quick action to get to know us and to work together.
Thank you. Dr. Morthon?
Just a wonderful report. Thank you. Thank you for sharing.
Anita?
I'll echo those two comments. Really wonderful work. Thank you.
Thank you. So now we have our wonderful Jacoby Miss Charmaine Graham.
Thank you. Good evening, everyone. My name is Charmaine Graham, and I'm the chairperson of the Community Advisory Board of New York Health and Hospital Jacoby. I'm going to share with you the progress and initiatives of Jacoby today. This fall, Jacoby will receive 249 Centinela beds along with 13 new ICU beds. We also received new secondary MRI equipment for radiology department. Jacoby CPEP has satellite at North Central Bronx with 3 extended observation beds. We launched a new program called Critical Time Intervention and Expanded Substance Use Disorder Service, included the opioid treatment program and addiction response team. Jacoby also received silver certification from Plantry. We also implemented a 3-wish project which honored dignity and improved the dying process in MICU, CCU, and SICU. Now we have therapy dogs on call whose visit reduce stress, improve health, and boost morals for patients and staff. H3 has had 504 staff encounter and 227 wellness rounds. Staff attitude and communication continue to be a global challenge, and the patient relations rounding program addresses concern in real time. Patients also report difficulty sleeping due to noise and interruption. To address this, CCU is trailing noise reduction program, which include quiet time, noise meters, and earplug, also eye mask. Complaints. Complaints related to quality of care are referred to leadership for evaluation. A grievance committee reviewed quality issue monthly, addressing trend and structural inequity and biases. Issues impacting the community. The community Jacoby serves face many issues, including chronic disease and mental health concerns, barriers to accessing health care because of underinsurance, no insurance, or language barriers, high rate of unemployment, poor housing condition, and limited access to healthy food. Community Advisory Board and Ambulatory Care Initiative. We had our back to school fair on August 29, where we had 1,200 participants, provided 500 backpacks and school supplies in partnership with MetroPlus and 70 community partners and internal department. Many members participate in Stop the Bleed and Active Shoot preparedness training to empower community members in emergency situation. The CAB hosts a legislative breakfast with elected officials to discuss local health issues and need, and Jacoby CAB members join NCB CABs in the donation drive and collection or community during the winter spring holidays. Okay, slides and acknowledgement. Thank you to NYC Health and Hospital Board and Councils of CAB, A very special thank you to Christopher Mastromano, CEO, Jordana Bailey, COO, Donna Greaves, Chief Experience Officer, Dr. Michael Zinnerman, CMO, Jocelyn Medina, AED, and Taylor M. John, our CAB liaison, and the entire campus hospital leadership cabinet for their dedication to health, equity, diversity, inclusion, and accessibility. Thank you all for listening.
And thank you.
Thank you.
Thank you. Dr. Katz?
No questions. It's a wonderful report.
Yes. Dr. Morthon?
Wonderful report, thank you.
Anita?
I agree. Wonderful report, thank you.
So I have a question. So the question, when you talked about the noise reduction and force, you mentioned to address the patient complaint. Have the effort been successful at reducing the level of the noise at night?
Not yet. So the noise meters, and we have some items in our CCU to really start there. It's had some impact, not the impact we would hope. So we continue to work, remind staff to keep their voices down at night if they're talking at the nurse's station because it carries when it's quieter. We've lowered some of the lights in the corridors at night, so we continue to focus on that.
It's good to hear. So you're working on it. Yeah, very important. Well, I figured that, but I had to ask. Thank you. Now we have McKinney. Okay, Miss Deborah Terrell, cab chair.
Yes.
So I just want to take a moment to welcome our new CEO at McKinney, Dave Forbes Thomas. Is that you? Okay, welcome to the CRC meeting. So you're gonna be, that's great. Now you got a little idea of our 5 minutes that we talk about. So we're looking forward to working with you, and we're looking forward to your CAB presentation. So again, welcome. Okay. Did I pronounce your name right? Daffin. Okay. Daffin Forbes Thomas. Okay. Daffin. Okay, I'm gonna get it right. No, thank you.
Good evening, everyone. As chairperson for the Community Advisory Board at New York City Health and Hospitals McKinney, I'm going to share with you our progress, initiatives that highlight our ongoing commitment to enhancing our facility and our Brooklyn community. Infrastructure. We're happy to share that McKinney recently completed an installation of solar panels on its rooftop, which will supplement McKinney's daily energy use with cleaner, greener, renewable power. We have also installed new lighting in our facility, and upgrades to our cooling system are ongoing. McKinney has also installed a passage point system for visitors and is implementing a blue pin program to improve inventory management of medical supplies. McKinney has 80 resident beds and 10 bariatric beds, and recently acquired new automated external defibrillators and auto pulse vital sign machines. Resident rooms are in the process of being refreshed. Capital Improvement Awards. We are grateful for the awards from Council Member Rita Joseph. We received 500,000 for the wellness market renovation at the resident gift shop and 400,000 for the resident healing garden. Person-centered care. At McKinney, we have many programs and initiatives to improve the quality of care for our patients. We have a new admissions, gifts, and welcome committee, and all about me signage in residence rooms. We also hosted many events for our residents, including a county fair, a parade of the bands, Adopt a Resident pre-Thanksgiving dinner, holiday festivities for the residents, therapeutic outings, and resident and family BBQs. We have a gardening club for our residents. We are happy to see the impact through positive press gaining results. Employee wellness. McKinney's H3 leadership continues monthly interventions in promoting eye care programs. These programs include Compassion Card Tuesdays, All Stars program, Wellness Expo, aromatherapy and meditation, Staff Appreciation Day, Power Hour, Arts in Medicine, morning and afternoon meditation and stretch. Issues impacting the community and residents. Complaints. Some of our frequent complaints include residents are unable to watch their favorite television programs due to issues with the satellite signal. Information technology attends in a timely manner to address the issue, and the goal is to transition the entire building from satellite to cable connection and have wall mounted TVs for each resident. A total of 80 beds are already completed. The majority of residents prefer to enjoy meals that are culturally representative of their ethnic background. We've conducted surveys for meal preferences, and more ethnic meals are now incorporated into the meal. Due to increased vehicle traffic creating a safety hazard, we are requesting installation of no standing zone signs on the street curb adjacent to the facility. Registrants expressed disappointment on pending closure of Neponsit Adult Healthcare Center. Registrants are being assisted with transition to alternative programs. CMS. We are thrilled to share that McKinney is the only long-term care facility in New York City with 5-star CMS ratings in all domains. This is a testament. This is a testament to the commitment of all of our staff at the facility. Accomplishments. McKinney was ranked top among top 20 nursing homes in New York for 2025 by Newsweek. They were also ranked by US News and World Report as the best nursing homes 2025, high performing in long-term care. McKinney is also a designated leader in the long-term care equality for LGBTQ elders. Acknowledgements. For their ongoing support, our special thanks and gratitude are extended to our elected representatives, Borough President, Borough President Antonio Reynoso, New York City Council Speaker Adrian Adams, New York City Council Member Rita Joseph, New York State Assembly Member Brian Cunningham, New York State Senator Zelnor Myrie, U.S. Congresswoman Yvette Clarke, and the McKinney Community Advisory Board, McKinney Auxiliary, and McKinney residents. This ends my report.
Thank you so much. Great report. We have some good reports here today, I tell you. Dr. Katz?
Very happy, and I've only heard great things about your being the new CEO, so we're very glad to welcome you.
Absolutely, absolutely. Dr. Martin?
Congratulations and welcome, and great report,
you.
really.
Nita?
Holding that rein tight.
5 stars.
Thank you for the excellent report.
Anita?
Thank you for the excellent report.
Thank you.
So, good job, good job. So, I am just proud to say that North Central Bronx is in the house. And now it's your turn for 5 minutes. Mr. Bob Cease, cab chair. Where's Bob?
Here he is.
Oh, hi, Bob.
Hi. And sites.
Okay.
Yeah. So I am relatively new to the world of cabs, and even newer as the chairman. So I've asked my predecessor, Joe Ithier, to co-present with me. And I did some Googling. Joe wears a size 20 shoe, so I've got some big shoes to follow. So, good evening, everyone. My name is Rob Seitz. I'm chairman of the CAB and for North Central Bronx Hospital. And tried to do this under 3 minutes. So the first thing was equipment and infrastructure on our list. And by the way, I got a wonderful tour of the hospital today for the first time, so I got to see a lot of these things firsthand. Those includes MRI installation, which is a work in progress, labor and delivery, which I didn't need, outpatient room upgrades, hospital police command upgrade, replace 2 freight elevators, and the renovation of the behavioral health patio, which is a very nice environment so that if you're inside, you can at least see what's going on outside, and it's right there. And the last but not least, the new emergency power generator. Now, not very sexy until New York City gets its next blackout. And in the middle of a major heart surgery, we're good. Our next item is patient-centered care and key programs. We're always measuring the satisfaction or not in a variety of ways of our patients, including complaints and grievances, receiving multiple modes such as patient satisfaction scores, surveying, publicly reported data, and our brand reputation. And speaking of Google, you can find anything online. So check out your hospitals. Inpatient satisfaction. We have stable HCAHPS, am I pronouncing that correctly?
Very good.
Scores over the last 6 quarters with ongoing improvement targeted. Emergency department is leading in system satisfaction with minimal wait times. And I visited the emergency room recently just to kind of check it out. And it was, as emergency rooms go, lovely. And so was the staff. Inpatient behavioral health, consistent improvement, surpassing New York State's average in the 2nd quarter of this year. And medical practice, high patient satisfaction with 85%. Take that, Ms. 5 stars. Great provider, 89%, and recommending the provider officer. So all good plugs for us. I'm going to turn it over to Joe.
Thank you. Frequent complaints by patients. The attitude, the communication, quality of care are our 3 most frequent complaints by patients. We have taken an interdisciplinary approach to improve and sustain communication amongst patients and caregivers. This approach includes training of all levels of staff through the I Care with Kindness campaign, bedside shift reporting, and leader rounding. Complaints are referred to leadership for evaluation, department chair, chief nursing officer, and director of nursing for the area involved, as well as the area administrator for evaluation. Improvement strategies. We continue to support all staff with wellness initiatives and resources. Onboarded a service excellence program manager and a person-centered care program manager. NCB's Wellness Program Director was onboarded in August 2024, and since her onboarding, we have increased the number of events and support touch points available to staff. Issues impacting the community. Similar to our sister, Jacoby, NCB faces many issues, including chronic health conditions, including respiratory issues, mental health, substance abuse, housing instability are some of the most prevalent issues impacting the community. Additionally, according to the Community Health Survey, there is a lack of green space for physical activity, thus resulting in child obesity. Mr. Chairman, you take it back.
Thank you. So the CAB and the ambulatory care initiatives, which I guess is the nearest and dearest to my heart. How can we support the hospital in this new year? we're unique, I understand, according to this, that we fall under the category of under the guidance of the ambulatory care department, which allows us for direct access and partnership for outpatient services. Recently, that department has been charged with support and community engagement efforts, such as health fairs, events, workshops, and as CAB members, we've been able to participate and facilitate and lead. And our CAB liaison, Taylor John, sends me about 100 emails a week of events that we can get involved with. So that's definitely happening. We had our back to school fair, like our friends at Jacoby, our co-campus, on August 29th. We had 1,000 participants. Started at 11. When I got there at 10:30, there was a line down the block of people waiting to get in.
Good.
Yeah. And it was very lively. We had a perfect summer, beautiful day, and people really enjoyed it. I got to meet a lot of the exhibitors and elected officials, so I felt we were off to a really good start. We have multiple community engagement and health initiatives, including 45 health fairs, as already noted, promoting wellness and preventive care. We hosted a Dress for Success health fair for career-focused women. We also hosted a toy drive and knitted items such as blankets and pajamas for babies and mothers, and participated in Black History Month and World Mental Health Day events. And I hope to expand that in this new year. We also held meetings with the Bronx Borough President's Office, who appointed me, by the way, and Councilman Kevin Riley's office. We've invited our elected representatives to our legislative breakfast, which is going to be so important this new year as we enter into budget negotiations and what's happening in Washington. And to discuss health needs, building our partnerships with local community leaders, police precincts, schools, YMCA, Boys and Girls Club. And final notes and thank yous. Charmaine already mentioned some of these folks, but obviously it bears repeating that our wonderful CEO, who's one of the most approachable men I've ever worked with, Christopher Mastromano, I hope I'm pronouncing that correctly, our CEO, Alfredo Jones, who is a great guy and who gave me the tour of the hospital today, our Chief Medical Officer, Shinier Aniago, and of course our liaison, who I mentioned already, Taylor John. The entire North Central Bronx Hospital campus leadership cabinet for their dedication to health equity, diversity, inclusion, and accessibility. And a notch or two down from the cabinet, the wonderful men and women who keep the place running on a daily basis, whether they're orderlies, nurses, people in the cafeteria. Those are the ones who keep the place running. Finally, behind every successful man is a woman. And in my case, I have two. Esma Sotelo and Luisa Hernandez.
That's good.
I look forward to working with you both.
Good.
Thank you.
And thank you. I thought I had to give you 1 minute, finger. Excellent, excellent, excellent. And I like how the dual, I was saying now, are they taking 5 and he doing 5 and they trying to get 10 in there? You know, but the teamwork, oh, that's what they did. But it was excellent, and thank you, and all of you. Keep up the good work. Yes.
Madam Chair, I just wanted to say that it was a privilege when I first started as chair at NCB to be here to present, and I ended with coming back to present, to say goodbye as chair, and I leave you with a great team with Robert and Esme and Lisa, and we have one other person, and they were invited to be here so they could see the work that you, the board, and Dr. Katz does. Thank you for allowing me to be a part of the family. I enjoyed myself. I learned a lot, and we're improving. And in the final note, NCB will be celebrating very soon 50 years.
Wow.
When people thought that NCB was going to be shut down, it's going stronger than ever with a great leader, my brother.
Oh,
Chris
thank you.
Mastromano and the staff.
Thank you. Nice closing.
Thank you.
This is 5 minutes.
Oh, this was a side note.
Yes.
In case this is being recorded, Nicolette Buddington is our secretary. She's not here today.
Okay, I see.
Yeah, I
just want to say thank you to HHC for 10 years on my assembly. They always come and interact. All of the members at the church is very proud and happy about it. Thank you.
And
Thank
thank you. Dr. Katz?
No further questions, thank you.
Dr. Moulton?
Thank you for your wonderful report. Thank you.
Nita?
Thank you for your report as well.
And thank you. Any old business? Any new business? Hearing none, and before that we adjourn, and I want you all to pay attention, and if you don't really understand, you got several people to call. You got Debbie, you got Afinte, to call. So, I want to remind everyone that the next CRC meeting will be Wednesday, November 5th, instead of Tuesday. And I understand this is the first time on a Wednesday that we will be, having it. And that's because the
Election
first
day.
and second Tuesday, yes, the first and second Tuesday in November are federal holidays. Election Day and Veterans Day. So we will have the meeting on a Wednesday for that month. We're looking forward to hearing presentations from Harlem Hospital, Sydenham Clinic, Metropolitan, and Woodhall. So, the hospitals will get the notice, the ones who's supposed to come. But they always bring the team. You need that team support. So again, November 5th on a Wednesday, 5 p.m. the same. And this is because of the federal holiday in November. Election Day and Veterans Day. So we will be meeting, and I keep saying it on the Wednesday, 'cause I have to program my brain too. So it's so important. Now, one of the good things is you all have a Fente number. You all know how to call Deb. And first of all, we want to thank both of them
Yes.
just for the good work that they constantly do.
Felicia, who makes it all.
And they constantly do, and they can't do it without Calicia team, Johnny. It's a lot of work, and we commend them. And just give them a call if you forget, And their door is always open. Is it? Am I opening your door? Is your door?
Everybody have my number.
Everybody have your number. Okay. And again, keep up the good work. I look forward to these meetings, and I found out so do you. So be safe, stay safe, and stay well, and keep up the good work. Thank you.
Same to you.
Oh, thank you. Okay.
This meeting is no longer being recorded.